A kid's book about COVID-19. A kid's book about COVID-19, also called coronavirus disease 2019. Written by Malia Jones. The world is facing an unprecedented public health crisis. I study epidemics, and I have a good understanding of what's happening. And I have felt uncertain and vulnerable over these last few weeks, too. A lot of adults are feeling uncertain and afraid. As a parent and a scientist, I know that kids can tell when we have negative emotions. When we feel afraid, worried, lonely, angry, or sad, I want to teach my kids that it's okay to have feelings and talk about them. I want them to know that we've got each other and that it feels better to have an honest conversation than to try to hide our feelings. You might not be an epidemiologist, but you are definitely the expert on your kids, and they need you to lead a conversation. They're ready to talk about it. I wrote this book to give you a starting point for that conversation. Hi, my name is Malia, and I'm a social epidemiologist.
Epidemiologist is not to be confused with a friendly hippopotamus.
That means I'm a scientist who studies how human diseases spread. This is my book about a new disease called COVID-19. Do you know what that stands for? It stands for Coronavirus Disease 2019.
So 2019 because the disease spread in 2019.
By now, you've definitely already heard about COVID-19, or its more common name, coronavirus, because everyone is talking about it all the time. It's a pandemic.
Pandemic is a disease that spreads all over the world.
Your school might be closed, sports may be canceled, and even the grown-ups around you might be a bit scared.
Are you feeling scared? It's okay. Adults and young people are feeling scared too. It's okay to feel that way.
It seems like the entire world is thinking about one thing. Coronavirus.
Coronavirus.
So I'm here to tell you what coronavirus is and isn't. Coronavirus is a new disease. COVID-19 has never existed in the entire history of the world. That means no one has ever heard of it.
Now many people are being hit with the coronavirus.
COVID-19 is caused by a virus.
The virus is called SARS-CoV-2. The disease is called COVID-19. But a lot of people just call it coronavirus.
A virus is a very tiny thing. So tiny you need a microscope to see it. That can get inside of your body and make lots of copies of itself. This can make you sick. You've definitely had a virus before. They cause things like colds and the flu. Coronavirus can cause a fever, a cough, stuffy nose, fatigue, or a headache. Some people who get it never even notice they're sick, and other people just have a little run-down feeling. But a few people who get coronavirus get very sick. Like really, 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 really sick. So sick, they have to go to the hospital.
If they get too sick, they could even die from the coronavirus.
Lucky for you, kids do not usually get very sick when they get coronavirus. But you can still give it to other people.
You might have heard that the coronavirus is just like the flu. It is not. Flu and the coronavirus are not the same.
It's different.
Coronavirus and the flu are different kinds of virus. Doctors aren't exactly sure how to treat COVID-19, but they're working on that.
It's new.
There is no vaccine. Doctors are working on that too. No one has ever had it before.
A vaccine is a medicine that keeps you from getting a virus by giving your body instructions for how to fight it later on. Usually, vaccines are given as shots. It's spreading faster.
COVID-19 infects you quickly and is good at getting other people sick.
It's more dangerous.
Compared to the flu, people who get COVID-19 are more likely to get very sick and die of it. Those people who get very sick and possibly could die are individuals that typically are elderly or possibly have some other illness.
There's still a lot we don't know about coronavirus because it's so new. Scientists are learning new things about it literally every day. But one thing we know for sure is how you get it.
Snot. Coughing and snot comes out. Snot. When someone coughs or sneezes, snot and spit flies out of their noses. Germs go everywhere.
Germs are tiny little particles that can cause you to get sick. Viruses are one kind of germs. Bacteria are another.
Those germs can land on all sorts of things and stick there, sometimes for days. Touches everything, like door handles, tables, tablets, pencils, even a sandwich. When you touch something that has a virus on it, they stick to your hands, and when you rub your eyes, you can get the virus in your eye. Or you touch a sandwich and put the sandwich in your mouth. Now there's a virus in your mouth. You could even accidentally breathe those bits of snot in if you're too close to someone who sneezes or coughs.
Yes, it's disgusting. Scientists call this droplet transmission.
You can call it snot, but scientists call it big words like that.
Droplet transmission is one way viruses get from one person to another. It catches a ride on small drops of spit or snot.
I know this all might seem really scary, and you may want to panic. Some grown-ups may want to panic too, and it is a little scary. It's okay to feel whatever you're feeling. But here's what you can do to help.
Don't pick your nose.
Or put your hands in your mouth.
Even if your fingers don't look dirty, they could have viruses on them. You should try to keep your hands out of your nose and mouth. If you insist on picking your nose, even after an actual scientist just told you not to, do it with clean hands. Which brings me to my next point. Wash your hands. Actually, wash them as often as you can. Use soap and water. Keeping your hands clean with soap and water helps a lot. It's especially important to use clean hands to eat.
It's important you must wash your hands a lot. Wash your hands with soap and water. You know the Baby Shark song? You can sing the Baby Shark song in your head. Wash your hands, wash your hands. Or even another song if you want. It's just important to wash your hands for at least 20 seconds. For a little while, you may be like a cocoon, just staying at home. That means for a little while, stick close to home. Don't spend time near other people. It's okay to go outside, but don't do it with groups of other kids. Scientists call this social distancing.
I told you, scientists love to use big words.
We all have to stay in our cocoons for a little while because this coronavirus is spreading so fast that scientists can't test everyone for it all at once. We don't know who has it and who doesn't. Just in case you already have it and you don't even know, we need you to stay away from other people who could get it from you. Are you worried that you already gave it and could give it to your grownups? It's not your fault if that happens. It's not your job to figure out who has it. Scientists are working on that as fast as they can. It's your job to be a kid.
And while you're just being a kid, you can do a lot for everyone else by doing simple things like washing your hands, not picking your nose, and cocooning for a while. We need to work together. If we work together, fewer people will get sick and be in danger. If we work together, the disease will spread more slowly, and scientists will have more time to figure out a fast way to test people for the coronavirus, the best treatment, and a vaccine. It will take everyone's help to keep away from each other and stop COVID-19 in its tracks. If everyone helps, we can keep ourselves safer and keep the people around us safer too.
The next step in dealing with COVID-19 pandemic is to implement widespread rapid testing. We need to know who has it in order to prevent further spread of the disease. We do not know how long it will take to get testing capacity up to speed.
There are actually lots of different coronaviruses out there and have been for a long time. It's a whole family of viruses. They're called coronavirus because when you look at them under a microscope, they're shaped like a sun or a corona. This particular coronavirus is brand new to the world.
This coronavirus is a genetic cousin to the virus that caused the SARS outbreak in 2003, which affected over 8,000 people before it was contained successfully.
The virus that causes COVID-19 probably came from an ancestor virus that infected some other animal population. We don't know what kind of animal it came from yet, but someday we probably will.
Dogs and cats can get other coronaviruses, but not this one.
Soap kills viruses by making them explode.
We do not know if the outbreak will end when the weather warms up, but we suspect that the weather doesn't really matter to this virus much.
We don't know how many people who get COVID-19 will die from it, but we think it's somewhere between 6 in 1,000 and 35 in 1,000. We also don't know how many people will ultimately get COVID-19, but we know that when the slower the pandemic gets, the easier it will be to deal with.
People from Asia or other ancestors from Asia are no more or less likely to get or transmit COVID-19 than anyone else. All kinds of humans can get the virus. Older humans are more likely to have a serious case that requires hospitalization.
Scientists are already working on a treatment and a vaccine. Scientists are already trying new treatments, but a vaccine won't be available at least a year and a half, and maybe much longer.
Scientists who study epidemics are called epidemiologists. Epidemiologists are one part of science called public health. the study of how groups of people stay healthy. Maybe you can help prevent the next epidemic when you grow up by studying public health. That could be your future job. Now that you're equipped with all this information, what do you do now? Hopefully, you start out by just talking with your kiddo. I'm sure they'll have questions and certainly some thoughts of their own. Try to listen as much as you talk. Hear them out. Then you can start with these 4 questions. What are you worried about right now? What questions do you still have about the coronavirus? What creatures do you know of that use a cocoon for protection? What are you most grateful for today?